Bloating and PCOS. There are so many reasons. So, hormonal imbalance is the most important. Increased androgen and estrogen dominance can affect the digestion and cause bloating. So then insulin resistance also can slow down the digestion and cause bloating. And the gut microbiome imbalance happens in PCOS, and there can be inflammation in PCOS which can also affect the gut health. So what is the remedy for bloating? So you have to improve your lifestyle, that is include low glycemic food, include the anti-inflammatory food like high fiber diet, so whole grains, lean meat, so decrease your sugary items, refined carbs, so all your oily items. So then automatically bloating starts improving. Exercise also aids digestion and decreases the bloating. And the probiotics, fermented food like your yogurt and gut probiotics can improve the bloating. So exercise and your lifestyle, the dietary habits will definitely decrease the insulin resistance, decrease the androgen levels, which in turn reduces the bloating. If bloating is manageable with the lifestyle changes, good enough. Otherwise, if it is associated with severe pain, any bowel changes, not getting better with your lifestyle, please consult your gynecologist. If necessary, they'll refer you to even the gastroenterologist. Hello, I'm Dr. Shailaja. Polycystic ovarian disease. Please don't call it as a disease, it is polycystic ovarian syndrome. Both are same, but polycystic ovarian syndrome is a newer terminology. Because it is constellation of so many symptoms, that is why it is called syndrome rather than disease. So polycystic ovaries don't target the ovaries. Don't think problem is within the ovary. It is a lifestyle disorder. It is a genetic problem. So there is family history of PCO or diabetes. Those genes actually make what? Insulin resistance. Means your body is not responding to insulin in the body. So that is the reason your sugars may go up. Because of the insulin resistance, there can be hormonal imbalance. Androgens will go up. Androgens cause what? There will be obesity, especially truncal obesity, and excessive hair growth, hirsutism, and there is hair thinning. That is why alopecia, you lose hair. And also there will be menstrual irregularity because there is no ovulation because of excess androgen in the body. There is estrogen dominance. So what happens? Your cycles get delayed, irregular, sometimes heavy bleeding because of the estrogen dominance. The uterus lining becomes too thick. So these are all the impacts of the PCOS on your body. See, because of the insulin resistance, also there can be cholesterol increase in the body. There can be cardiovascular diseases, hypertension. Because of the uterus lining thickening, it can turn into cancer. But people read only about the terminal things and they get scared. So don't worry. Especially when you take treatment, you will not develop all these cardiovascular disease and the cancer parts. So then coming to how to manage your symptoms. First and foremost thing is lifestyle changes. You should manage your diet. So you should include low glycemic diet. So that means what? It is whole grains, vegetables, fruits, rich in fiber. So you should avoid snacks, refined carbs, fatty food. So increase your proteins, reduce your carbohydrates. So that time your insulin resistance starts reducing. Along with this, important is the anti-inflammatory food like fatty fish, nuts, so grains, all these things will actually reduce the inflammatory process in the body which is induced by the androgen. So coming to exercise, very, very important part of PCOS care. So at least 30 minutes exercise 5 days in a week will reduce the insulin resistance. It can be swimming, jogging, your gymming, anything is fine. Strength training also will reduce the insulin resistance in the body. Yoga will help to reduce your stress. Your cortisol level will come down. So that will help in hormonal balance. So diet, exercise are the foremost things. So then coming to the treatment part. So healthcare providers usually may start you on birth control pill. Don't get scared. It is not going to have any adverse effect on your body. So if at all you have any migrainous headache or if you have certain blood clotting problems in the family, healthcare providers themselves don't give you birth control pills. See, nowadays the fourth generation pills, whatever are available, they're very, very helpful to bring down your androgen levels. When you have too much of acne, hirsutism, so these birth control pills will help to bring down those androgen related side effects along with regularizing your cycle and normalizing your blood flow during menstruation. So next medication commonly used is the metformin, the insulin sensitizer. So metformin will make the insulin resistance less and androgen levels better. So your sugar levels also get normalized with metformin. So in place of metformin, nowadays we are using inositol, which will reduce your insulin resistance, fenugreek extract. All these things are the natural methods of bringing down your insulin resistance. So you should not have resistance to medications. You should use it when necessary to make your PCOS symptoms better. Along with these medications, you can think of using even omega-3 fatty acid, which will reduce the inflammatory process in the body, that can reduce the bloating sensation, that can help to reduce your weight as well. So these are the few strategies we see with the consistent commitment towards your lifestyle changes like diet, exercise with the right strategies. Definitely you can overcome the symptoms of PCOS and improve the quality of life.